I'm Janet. I am a registered dietitian, and today I will talk about diet, nutrition, and hopefully give a bit of clarity to everyone as well. I do want to say thank you all for your time, for coming to this session and hearing me speak, but I also want to thank you, Target Ovarian, as well, for this opportunity to share. So I won't have much time, so there's a lot to go through, so I want to try and get through all of it as much as possible. But again, there will be Q&A, so if I don't answer everything throughout my presentation, please feel free to ask away, and I'll try my very best to answer your questions to the best of my ability. Thank you. So this is just my disclaimer. So if you're already under the care of a dietitian, or if you've seen a dietitian and they've given you dietary advice, if they're a registered dietitian, then actually what I talk about today doesn't replace or override any information that's already been given to you, because actually they're probably more aware of your current situation, and my information today might be more general. And so if that is the case, then just focus on the information that's already been given to you from your registered dietitian. And if you are requiring further dietary information and you need further one-to-one support, then please feel free to speak to your doctor, your GP, and ask to be referred to a local dietitian, and we'll want to support you one-on-one. What I hope for you today is to have a greater understanding and knowledge of the dietary information that's out there. So I'll hopefully unpack a bit of those big questions on, you know, the cancer fighting diets and things like that, and just to give you my opinion on those, what's evidence-based, and kind of unpack that a bit more so you have a bit more awareness of where that's come from and what's reliable. I also want to hopefully increase your awareness of the nutritional implications of your diet, so actually how your dietary choices can affect your health and how you can improve your nutrition. So particularly if you're struggling with side effects from chemotherapy, if you're struggling with malnutrition per se, or weight loss, actually what you can do to your diet to improve that. And I also really hope that you build in your confidence in knowing what foods to eat, what foods to eat less of, what is healthy eating, and actually where to find out further information. So knowing what reliable sources are out there, and I hope to give you a bit more information on that as well towards the end of the presentation. So first off, when I type into Google, you know, diet and cancer, diet fighting cancer, so you know, it's there's lots of mixed messages out there. And I know it can be very confusing. So I'm hoping this is just a slide to show actually how much information, what kind of images come up, and I'd like to just really tackle some of those today. But again, if there's some topics that I haven't touched upon, then please feel free to ask away towards the end. So my first question, or the first query that I want to try and tackle, is sugar. So does restricting sugar help? You know, often there's questions about, does sugar actually feed cancer? Does restricting sugar, my carbohydrates, help treat my cancer? Does it slow down the growth of cancer? That is the question I'm trying to answer today. It's often, you know, when someone say I'm on a restricted sugar diet or a low carbohydrate diet, sometimes they're also classified as a ketogenic diet, so a very low carbohydrate, which is roughly about 50 grams of carbohydrate, where your energy from your nutrition is only 10% from carbohydrates. That's how low it is, and actually it's a diet predominantly high in fat and high in protein. So just to sort of wind back a bit of actually where this comes from, the background behind this is that from laboratory studies we can see that the cancer cells have a typical metabolism that favors sugar. So it likes to burn sugar to use it to create energy. And we find that these cancerous cells, because they multiply quickly, they therefore need a lot of sugar and therefore a lot of energy to grow. And so actually it's based on this theory that actually if you restrict the sugar from your diet, and that's including your carbohydrates and things, then potentially it has that restriction to slow down the cancer cells from growing, or can help treat the cancer. But actually there's not enough evidence at this present time from any clinical trials to actually prove that restricting dietary sugar can actually stop or slow down this cancerous cells. So from my opinion, and from the evidence that we've looked at, there is not enough evidence to suggest that this diet would work, and there's a lot more harm in this diet as well. But what I want to say is that actually when you look at the cancerous cells, or when you look at the studies, actually, you know, not all cancerous cells favor sugar is firstly one thing, but also not all of the cancer cells, so there are actually some healthy cells in our body that prefer sugar as well. So reproductive cells, stem cells, they also prefer sugar as well. So it's not as simple as cancer and sugar. And I think quite a good analogy I come across was actually, if you think about almost like a London tube map, if you block off one, one station, actually there's lots of other diverted routes that you can go by. And it's quite similar to actually how cancer is within our bodies, is that actually it's not just as simple as taking away the sugar, take away its energy source, and then it stops completely, because actually there's not enough evidence from human trials to say that. And when you look at the animal studies, actually what you do see is that there's at least 40% weight loss in animal studies. And actually when you think about that being in humans or in a person, losing 40% of their weight is just not appropriate. It's just not safe. And therefore, you can't simply just apply what's happened in animals or what's happened in laboratories to then say, this is what's going to happen in humans, and then put it into practice and for us to endorse it. So at this moment in time, there's not enough evidence to suggest that it would work. And also when someone restricts their sugar, I think fair enough if you restrict things like your cakes, your crisps, your chocolates, your biscuits, things that are very high in refined sugar, which will contain lots of calories. But this is talking about restricting all of your carbohydrates. And actually carbohydrates would be things like your whole grains, your fruit, and that provides a lot of dietary fiber. But also if you're lacking in your fruit as well, and you're restricting that as well because of the natural sugar, you're then at risk of vitamin deficiencies. It's also very difficult to comply with this diet because actually you're going to be getting a lot of weight loss, a lot of tiredness and fatigue, and therefore it's going to be really hard because your body's going to be craving for that energy, craving for the sugar, for it to sustain itself and to maintain its muscle mass and its function. But you also might even have increased gastrointestinal symptoms, so things like constipation because of the lack of fiber, or potentially opposite. And you might have diarrhea because actually the diet is really high in fat. And so you might have cramping and diarrhea because of that high fat content. But all of this results to weight loss, a loss of muscle mass, because you lose weight so quickly when you eliminate sugar from your diet. That weight loss happens very dramatically over a short period of time. And when someone loses weight over such a short period of time, they lose also the fat, but also a lot of muscle mass. And that results into poorer performance status. So actually your treatment outcomes will be poorer, you'll have increased fatigue, you'll have a loss of strength, and there's a greater risk of malnutrition. So when someone asks me, what are my thoughts on sugar and cancer, it's not something that I would recommend. And it's not something, if you are following, I just advise that you speak to your doctors to let them know that you are following it. And if you're still keen to follow it, I'd ask for you to be referred to a dietitian, just so that we can support you one-on-one and just to unpack what it is that you're wanting to do, so that we can support you to make sure that you're as well as you can be to get through whatever treatment you're going through. My concern is with this diet is because not only that there's not enough evidence to suggest that it works, you put yourself at greater risk due to the lack of dietary fiber, the lack of vitamins, the fact that you're losing weight. It puts you at risk of malnutrition. And when someone already has a cancer diagnosis and is already going through treatment with all the treatment side effects, you're already at a risk of malnutrition. Then putting this restricted diet on top makes it even more complex. And that's why it's not something that we would recommend or advise. There is, however, an indirect link with being overweight, and that's associated with an increased risk of cancer. So sometimes if someone says actually cutting out the sugar, cutting out almost the junk food, it's because of the excessive intake of sugar. So eating a lot of it, you've got an excess of calories, which results to weight gain, and weight gain over time might result to being overweight. And it's the association between being overweight that's with the increased risk of cancer. So there's an indirect link there, but it's not per se that the sugar itself, it's not the sugar itself that's causing the cancer or resulting to the cancer or putting you at risk at cancer. It's the fact that excessive intake of sugar results to weight gain, then overweight, and overweight is associated with the risk of cancer. Okay. Next query that I'd like to go through is actually, does an alkaline diet work? And this is based on the theory that actually cancerous cells, or laboratory studies show that cancerous cells prefer an acidic environment. So the theory behind this is if having an alkaline diet can then make that unfavorable for the cancerous cells to survive, or it can make that environment unfavorable for cancer cells to stop it from growing or to treat the cancer. But actually this theory isn't actually true, because what you eat can't actually have a direct impact on your body pH. And that's because your body has very good, what we call buffer mechanisms. It has very good ways of getting rid of any excess waste or acid or alkaline in your body. So for example, your kidneys, it will get rid of all the excessive waste. So what your diet, if it's an alkaline diet, you might actually be able to change the pH of your urine, because your kidneys are overworking and trying to get rid of the product and the waste product, but it won't change the pH of your body. Again, you've got your lungs, which will breathe out CO2, and that's a way of getting rid of acid. So actually your body has these natural mechanisms which will get rid of any excessive waste to make sure that there's a balance in your pH, because it's a very narrow window that your body pH works in, and that is optimal for your body to maintain its function and its status. So actually it has very good chemical reactions and ways and methods of making sure that that narrow range is achieved. Also, there's an issue with this diet, is the fact that there's no consensus of actually defining what food is actually acidic and what food is actually alkaline. So there are several I've looked at, and there's one which is where they burn the food and it's the ash, the remnants of that, they then measure the pH, and the pH of the remnants of the ash will then determine whether it's acid or alkaline. Or there's another method which is what they call the Peral score, which is potential renal acid load score. It takes into account the phosphate, the potassium, the magnesium, and the calcium of the food, the protein intake as well, excuse me. So the protein intake and all that, and it calculates it and it creates a score, and that score determines whether it's acid or an alkaline. But actually you have a lot of contradicting evidence for that, and you've got a lot of contradictions from the categories. So actually one food from this method might say it's acidic, the other method might say it's alkaline. So it's always contradicting, and that makes it even harder to justify following this diet. So it's not something that's really evidence-based. So it's not something I would recommend at all. The diets tend to lack in protein and also lack in calcium. So what that would be is sort of no meat, no fish, lentils, poultry, chicken, turkey, dairy or dairy products, and eggs as well. And actually protein is really important because it's almost the simple building blocks for your body, especially in infection and immunity and things like that. It needs a lot of protein. It's important for that. Calcium also really important for bone health. So actually by reducing this diet, restricting it just to an alkaline diet, there's a risk of malnutrition from lack of potassium, but also lack of protein. And also it's not evidence-based. However, it does promote fruits and vegetables, which have protective effect. So it will ensure that you probably have your 5 a day, which is good, but it unnecessarily restricts your diet. Okay, the next question is, are there consequences to consuming dairy? So I wanted to talk about dairy because often there's questions about, soya and hormones and linking to estrogen and breast cancer or cancer in general. And I just wanted to sort of share with you actually the studies that we can see that are available regarding dairy products is actually that dairy or a diet that's high in calcium does actually show more protective effects against cancer. So there's actually more benefit we can see from the studies rather than any harm. So from that alone, I'd say it's safe and healthy for you to have. We can see that actually there's limited evidence that diets high in calcium or dairy products decrease the risk of breast cancer, but there's inconsistent information and evidence that it potentially might increase the risk of prostate cancer. But then again, that is inconsistent. There's more stronger evidence suggests that dairy products decrease the risk of colorectal cancer, but actually from the studies, it doesn't mention anything particular about ovarian cancer, unfortunately. But what we can draw away from this is to say that overall from the studies that there are available on there is that actually it's safe for you to have dairy products as part of a healthy, balanced diet. And there isn't any evidence to suggest that, soya or dairy related to cancer as a result of hormones. There's nothing to do with that. So there's no evidence to suggest that that is the case. I think if you are wanting sort of to avoid dairy, and dairy tends to be a very good source of calcium. So if you are wanting to avoid dairy, then just make sure that you are getting enough calcium in your diet from other sources. So besides your cheese, milk, and your yogurts. I know there was a question about calcium and what other sources of calcium are there. So sort of your green leafy vegetables, things like okra, kale, broccoli, they would be good source of calcium, as well as bones, sort of fish with bones, that would be a good source of calcium, or any sort of non-milk alternatives, so things like your soya milk, oat milk, rice milk, coconut milk, but just make sure it's fortified with calcium as well. Because actually if it's the organic versions, they probably won't be fortified. So just make sure that you have enough calcium in your diet if you still choose to restrict dairy from your diet. But actually from the evidence that's out there, we would recommend actually having 2 or 3 portions of dairy as part of a healthy balanced diet. I've just got at the bottom there, sort of the BDA is the British Dietetic Association. They have a really good calcium food fact sheet. And if you just type that into Google, BDA food fact sheet for calcium or British Dietetic calcium, they've got really good recommendations of, you know, what our recommendations are. So for an adult, it's about 700 milligrams per day. If it's a woman post-menopause, it's 1,200 milligrams per day. And it just talks about the different sources of calcium, especially non-dairy alternatives as well. So that's quite good for useful information to look at. I also want to talk a bit about vitamin D as well, because vitamin D and calcium sort of go hand in hand. So it's important that you make sure you have enough vitamin D and that you're not deficient, because vitamin D helps promote the absorption of calcium in your gut. So vitamin D is often made on our skin when we're exposed to sunlight, and that's fine during the summer. So from sort of March, April time to September, that's fine as long as you have reasonable exposure to the sun. But actually during the winter time, unfortunately, we don't get enough vitamin D from the sun, but also we don't get enough vitamin D from your food. So things like eggs or egg yolks, meat, your liver, that would be they would be sort of dietary sources of vitamin D, as well as sort of your milk and dairy products, as long as it's fortified. But actually we don't get enough of that. Again, oily fish would be one of them, but we don't get enough vitamin D from those foods. So actually I probably would recommend a standard vitamin D supplement per day. I think it's 10 micrograms per day, that is required as a sort of an adult. So I would recommend vitamin D supplement. If you know that actually you don't like dairy, or you don't really eat that much that's high in calcium sort of rich foods, then by all means you can easily get a over-the-counter calcium vitamin D supplement, which would be healthy and be fine for you to take on a daily basis. Okay, the next question is, does fasting help? So short-term fasting, from the results that we can see from laboratory and animal studies, it does suggest that short-term fasting could have a protective effect on healthy cells, whilst exposing cancer cells to the toxic effects of chemotherapy. So what that means is, so what we can see from laboratory studies is that when someone is fasting, it puts cells in a stress-like environment. And when our healthy cells are in a stress-like environment, it focuses, instead of its energy on growth and reproduction, it then focuses its energy, when it's in that stressful state or stress-like condition, it focuses its energy on repair and maintenance. And that's what we can see in the laboratory studies. But whereas when we look at the cancerous cells, actually they don't have that response. So theoretically, based on the laboratory and animal studies, there's a theory that if we short-term fast, induces that stress-like response, protects our healthier cells, but then exposes the cancerous cells so that they're more likely to be sort of receptive to the chemotherapy, and therefore you might have less side effects and actually might promote the work of the chemotherapy. But bear in mind, these are just based on laboratory and animal studies. So at this moment in time, there are very limited evidence from human studies, and the very, very small sample sizes, and there's lots of variables within the studies. So for example, in the human studies that we can see, even though they're very small sample sizes, there's a very strict criteria for the participants to even be involved. So they can't have a BMI less than 18.5, they can't have any comorbidities, they can't have type 2 diabetes or heart disease, they have to have not lost any weight previously, can't have any more than 10% weight loss, and if they did lose weight during the study, they had to regain that weight before they could proceed. If not, they were excluded from the studies. So again, the studies itself are very small samples, plus you've got this really strict criteria for the participants. And also total fasting period varies from 1 to 5 days. So again, we don't know whether it's 5 days that's more effective or 1 day that's effective. So it's really hard to then draw these valid conclusions from these limited studies. Also, the compliance to fasting is very variable. So actually, it's all based on, the participants telling the truth per se. It's subjective recall of symptoms, are they actually, if they're feeling fatigued, it's very much dependent on that person. So it's very much relying on that individual telling the truth as well. And also you've got different types of cancer that's involved. It might not just be one particular cancer, but actually they've got different chemotherapy regimes. It might be a combination of different chemotherapy regimes, or even different doses, higher doses, lower doses. So again, you have all these different variables all within these small sample sizes, and therefore it's really hard to draw valid conclusions to recommend this at this moment in time. So it's not something that we at present would recommend because of the lack of solid evidence. However, I think there's going to be further information, further research on this in the years to come. So it's maybe to watch this space, but at this moment in time, it's not something I'd recommend at this moment in time, because I think if someone's already struggling with the side effects from chemotherapy, if someone's already losing weight, which often is the case, and they're struggling with the lack of appetite, fatigue from chemotherapy, loss of taste, or these different side effects, that's already going to impact their ability to eat, and actually the diet is probably already going to be restricted. If we're asking someone to fast on top of that, it just puts them at greater risk, because the dietary intake is already going to be limited due to side effects or due to the cancer itself from feeling unwell. But then if you ask someone to not eat on top of that, then it's going to make them feel even more unwell and more vulnerable and more at risk. And that risk outweighs any potential benefit, because we don't have the solid evidence to draw these conclusions yet. So that's my take on it at the moment in time. Next couple of slides, I'd like to talk about how we can improve your nutrition. So nutrition support, especially when you may experience side effects or may experience side effects from chemotherapy, targeted therapy, radiotherapy, or anything like that. So if, for example, excuse me, if you have a low appetite or if you're feeling full, what I would recommend, and often this comes as a surprise over the next coming slides, it doesn't really focus on healthy eating. There's a real change in mentality when someone's on treatment, when someone's losing weight, when someone's got these side effects, there's a greater risk of malnutrition. And we really want to improve your nutritional status so that you're fit and well enough to get through any treatment that is planned, and that you have better outcomes from there. So actually healthy eating goes out the window. So if you have a low appetite, if you're feeling full, then prioritize your carbohydrates and your protein, because they're going to be your most important nutritional sources. So your carbohydrates are going to be your first line of energy for your body to nourish it, and your protein and carbohydrates and your fats are also going to contain most of your calories rather than your fruits and vegetables. It's not to say you can't have your fruits and vegetables, still have them, but if you are to only have something, then maybe have more of your carbohydrates and protein rather than focusing on your fruits and vegetables. Make sure you have a regular meal pattern, because again, when you've not got an appetite or when you're feeling full, you're not going to want to eat because you won't have those hunger cues anymore. So instead of actually saying, I'll eat when I'm hungry, because actually that might not happen. And you might find that if you do that, you go throughout the whole day without eating. And that's more of a concern, because we don't want you to be starving yourself. So make sure you have a regular meal pattern, set yourself times, but maybe just have something small, something easy to eat, but just making sure you're having it frequently. Smaller portions are always best, because then you're not feeling overwhelmed. And if it's a family member or so, I always say, if you're family, because often it will be family members that are cooking for you, and they'll probably want you to eat lots. They might be, really good at feeding you, but actually it's really hard to eat all of it. So I always suggest, ask them to put it on a tea plate or something, or if they bring out a big plate, just grab your own tea plate and just dish out your own portion from that portion that they've given you, so that gives you a way of controlling your portion size yourself. Again, try to fortify your food, so adding plenty of butter, cheese, cream into mashed potatoes, into soups, into your pasta, things like that, to try and fortify it. So you're thinking per mouthful, as many calories, as much protein as possible, because we know with a low appetite and feeling full, the number of mouthfuls going in per day is going to be limited anyway. So we want to make sure you're as well nourished as possible. Again, you might find that nourishing drinks are quite easy to get down, because when you don't have an appetite, the last thing you probably want is a 3-course meal where you have to sit down with a knife and fork to eat it. You know, you want to be going for quick, softer diet, you know, fork mashable foods that you can just eat with a fork, doesn't require as much effort to chew, doesn't require as much time to eat it as well. And nourishing drinks, you know, it could be either supplements, it could be homemade drinks, you know, blend up some fruit with some milk and a dollop of ice cream, some cream, you know, having some added season to that, you know, extra things to give you the nourishment, the calories and the protein. By all means, that, you know, fruit smoothies are a good way to get the extra minerals and vitamins in, but if you make it up with milk, then that's a good way of getting the extra calories in as well. So how to improve your nutrition when you're tired or you're fatigued. So I would say carbohydrates is key, because that is going to be your main source of energy. So making sure you're almost eating around the clock and eating little and often, so that you're fueling your body with energy each time. There's no harm in putting things in the freezer, batch cooking, so that you don't have to spend as much time cooking all the time. You know, having even frozen vegetables, frozen fruit, that's fine for you to have. Tinned fruit, or even like jars of sauces or things like that, it's fine for you to use those for the time being, because we know it's only going to be temporarily this period of time when you're feeling so unwell that we can use this. And often it is always best to cook from fresh, because there's less salt, less fat and things like that. But this moment in time, if you're struggling with fatigue and tiredness and you're losing weight as a result of it, actually we want to make sure you're as well nourished as possible. Again, if you have taste changes, some people say that, you know, red meat particularly can taste quite metallic. So often I just say avoid it. You know, don't have the red meat, have a better alternative or a different alternative. You know, have your chicken or your turkey, try it with mince, or can you season the meat with some herbs, spices, just to try and mask that taste. Sometimes even eating with metal cutlery can make food taste a bit metallic. So it might be worth trying to use wooden, you know, spoon or fork or knife, you know, or you know, using plastic or something. But I always say, you know, if something tastes off, try adding different herbs, spices, lemon, limes, just to try and make the taste a bit different. But if it doesn't taste right, just don't have it for the time being, and just maybe have it in a couple of weeks' time. I always say, don't rule it out completely, just park it to one side and then reintroduce it at a later date, because actually over the period of your treatment, you might find that your taste changes quite quickly. So one thing might taste awful now, but actually in a couple of weeks later it might not. But just make sure you're having suitable alternatives to replace that nutrition as well. If you're feeling, if you're struggling with nausea and vomiting, what I would suggest is don't starve yourself, because actually sometimes being sick on an empty stomach just makes things worse, because you're always constantly retching and retching and nothing's coming out, and you're not bringing anything up. So I'd always say just have something small so you can easily digest it, but then it settles that kind of stomach a bit more. Have little and often. And always try and make sure you take your anti-sickness medication before meals, so roughly about 20 to 30 minutes beforehand, to make sure that it kicks in before you then start to tackle in your meal. And if you're not on any anti-sickness medication, it becomes a recurrent issue and that's stopping you from eating, just speak to your doctor, your GP, and see if they can prescribe you some, so that it can help you with the symptom. Identify any food triggers. You know, sometimes people find that actually hot foods, the smell of the hot food just triggers the nausea. Then don't have hot food, you know, have cold food. Try having sandwiches or hummus with some, you know, veggie sticks or something like that. Just something small that you think you could manage. Go for what you fancy. Again, sort of have a little experiment with the foods, see if you can notice any food triggers in particular, if it's certain smells or certain tastes, if it's blander foods that you prefer. Have a look and go by how you feel. And sometimes people might find that their nausea is worse at certain times in the day. To see if that's you. You know, some people find that actually their nausea is worse in the morning, but it gets better as the day goes on. And if that's the case, time your meals around it. So don't not eat at all, but just have a small amount in the morning when the nausea is worst. And actually when the nausea starts settling in the evening, have a bit bigger meal and make up for it by having little snacks throughout the day. Some people say, and I've got a picture of some ginger there, and that's just to say that some people find that ginger helps, you know, whether it's ginger to cook with or ginger in hot water and some lemon, something like that. I don't know if it's evidence-based. I don't really endorse it, but that's what I've heard. So there's no harm in trying that as well. So why is it important to almost park healthy eating to one side when we're struggling with symptoms? It's because actually we want to really avoid weight loss. So anything more than 10% is what we classify as significant, and that's when we can see that it has detrimental effects further down the line. What happens is when you lose a lot of weight over a short period of time, you lose a lot of muscle mass as well as your fat mass. And because you've lost the muscle mass, you then reduce your strength, your quality of life, and you have increased fatigue and tiredness. And actually overall, this can have an effect on your response to treatment and increase your risk of infections as well, because you're not strong enough to overcome them. And this all, you know, when someone's losing lots and lots of weight, actually they're probably very well malnourished. And that malnourished state delays wound healing, increases the risk of infection, and delays response to treatment as well. So if that is what you're struggling with at the moment, I would recommend that you speak to your doctor to ask for support and ask to be referred to a dietitian so that we can support you and give you more tailored advice. It might be that you need to consider a supplement drink or something to help you, excuse me. You know, if you've tried the supplement drinks and you don't like them, you know, by all means have some homemade supplement drinks. Have whatever flavor you fancy, whether it's chocolate, banana, strawberry powder that you buy from the supermarkets, make up with some full fat milk, add a dollop of ice cream in, blend in a banana, whatever it may be, to make it more palatable for yourself. But make sure that you're having something to supplement, to increase your calorie intake so that you're supported. And at this moment in time, healthy eating wouldn't be the priority. I know there was a question about a multivitamin and what I'd recommend. So what I would suggest is, if you are malnourished, if you find actually you are restricting your diet at some sort of level, whether it's intentional or unintentional that you're restricting your diet, multivitamin, anything from the sort of over the counter, like an A to Z multivitamin would be fine for you to have. And make sure that it has vitamin D, make sure it has calcium, make sure it has iron, especially if you're feeling quite tired and fatigued. Just be careful there, because I know some excuse me, some treatments will have a prescription for thiamine and folic acid as well. So if that's you and you're already taking those, and just be careful it doesn't overlap with the multivitamin that you're taking. If it does, just watch out and just speak to your doctors or speak to the pharmacist, just so that they can double check to see that you're not overdosing yourself with that particular vitamin. What can I do to keep myself healthy? So actually, if you're not in the category that we just spoke about, actually your appetite is fine, you're just wanting to know what I can do to keep myself healthy, whilst that's on treatment, whether that's off treatment, whether that's after treatment, whether that you're in remission, whatever state you're in, as long as you know you're fit and well, you've got a good appetite, there's no nutritional concerns, you just want to know what to do with your diet, what's best, then I'd recommend sort of looking at the World Cancer Research Fund. And this is a very, very large organization, very large charity. It's endorsed lots and lots of funding into international research. And so you have these international panel of experts who've looked across thousands of studies, compiled them all together, critically analysed to find out what relation there is between diet, weight, exercise and cancer. And they've come up with several recommendations, which is based on this today. Again, if you look on the World Cancer Research Fund and look in the dietary recommendations or healthy diet, then you can go into more detail from there. But first, it asks you to be a healthy weight. So if you find that if you're at the moment overweight, then actually gradual weight loss might be quite ideal, and roughly we'd look about 400 to 600 calorie deficit. So if you're currently maintaining your weight from what you're eating, but you're overweight and you're wanting to lose a few pounds each week, then actually removing about 400 to 600 calories from your diet, we will see roughly about 1 to 2 pound weight loss over the next over each week. And that's gradual weight loss, and we want that if that is the case, and we want it to be gradual because we want to make sure you maintain your muscle mass, but also it's lifestyle choices, it's sustainable for your lifestyle as well. you would like, we'd recommend diet rich in whole grains. So things like your brown bread, brown pasta, brown rice, basmati rice, whole grains, whole grain rice, wild rice, beans, pulses, lentils, things like sort of sweet potatoes, potatoes with the skin on, vegetables and fruit. So high fiber. Aiming for at least 5 portions of fruit and vegetables a day, and beans and pulses would count towards one of those. If you're having a glass of orange juice or a glass of fresh juice, that I think it's about 120 milliliters would count as one of your 5 a day. Anything more is just excessive, so I'd probably avoid that. Just have 1 glass a day, but you want to be aiming for at least 5 portions of different fruit and vegetables. So almost go for a rainbow color, I'd suggest. Try and avoid fast foods or foods that are high in fat or high in sugar, again, because they tend to be very high in saturated fat or refined sugar. So this is not necessarily the carbohydrate sugar that we're talking about, but this is foods that are almost like your sweets, your chocolates, your biscuits, cakes and things like that. Foods that are high in fat, your pastries, your chips, your crisps, things like that that are fried. And that again will be excessive amounts of calories, which will lead to weight gain, and weight gain is the increased risk of cancer. Try and limit your consumption of red meat and limit your consumption of processed meat. So I know there was a question about sort of limiting red meat as well, because red meat tends to be very high in iron, and that's good and is important. Otherwise, if you're low in iron, you feel quite tired and fatigued. So what the recommendations are to have no more than 3 portions of red meat per day, and 1 portion I would say is roughly about the palm size, sort of your palm, the size of your palm. That's roughly 1 portion. And other alternative sources of iron, if it is red meat that you're completely eliminating from your diet, would be things like liver, beans and pulses, green leafy vegetables, so things like your broccoli, spinach, kale. They would be really high sources of iron, but also recommend that if you're having iron, then actually to try and have it with a glass of juice or glass of juice that contains vitamin C, because vitamin C helps improve the absorption of iron, specifically plant-based iron. Try and limit your processed meat. So processed meat would be things like your sausages, your burgers, cured meat, smoked meat, because actually you've just got excessive fat, excessive preservatives, and excessive just salt in those as well. So red meat in moderation is fine. Having 3 portions per week is fine. What you can do is have, you know, your non-meat alternatives, or you can go for your chicken or your turkey, your leaner meats. You can go for your corn, your soya, sort of bits of, you know, your beans and pulses, lentils. I always say, you know, it's quite helpful because sometimes people don't like the taste of corn, or they find that it's not as strong as meat. So you can always do half and half. That's quite a good way. So you do half your minced beef, half minced corn, mix it together, add in lentils as well to thicken it up to make it more of a sauce, and then you've got really high nourishing, high in protein, but also reduces your consumption of red meat as well. Limit your consumption of sugar sweetened drinks, so things like your fizzy drinks. Try not to drink any alcohol. If you do want a glass here or there, make sure you limit yourself to the national guidelines, which is your 14 units per week. Try to spread it over 3 to 4 days, and try to have at least 2 or 3 days of alcohol free. Try and move more and be active. So it really involves exercise as well. I think the general recommendations are about 150 minutes per week of moderate intensity. So that's almost like 30 minutes 5 days a week. That's kind of what we're looking at. And it could be things like gardening, fast-paced walking. So when we say moderate intensity, it's almost like you're a bit out of breath, you can talk, but you can't sing. You know, or the alternative, instead of moderate intensity, you could go for high intensity, and about roughly it's recommended about 75 minutes of high intensity per week. So that'd be like running or fast cycling or something like that. So you're really out of breath when you're doing the activity or the exercise. So in addition to World Cancer Research Fund, what their recommendations does actually tie really nicely to NHS national guidelines for healthy eating. So obviously this is the Eat Well plate, which often is very, you've probably already come across already, which talks about the different proportions of the food groups in relation to each other. As you can see from this diet, it is very much based on, you know, your fruit and vegetables, making sure you're having at least 5 portions per day. Again, basing your meals around your carbohydrates, but choosing the whole grain or high fiber versions so that you've got that nourishment from there. limiting your protein intake, but making sure you do have some. Try to limit your red meat, making sure you're having fish, your non-meat alternatives, and also including your dairy or your dairy alternatives as well, to make sure you've got adequate calcium. Limit your high saturated fats, and also your sugary foods as well, and make sure you're drinking plenty. In terms of further information, I just wanted to go through this quite quickly. So you've got your World Cancer Research Fund, which is where you get your healthy eating and your recommendations for a healthy, balanced diet and lifestyle. On there, you can also look at a health check, and it's just a health check that they have on their website, and you answer questions, and it's like a little interview kind of thing. And it's really quick, only a few minutes, and it kind of tells you how far you are away from their recommendations. It just gives you a bit of guide on where actually you might need to focus your energy on. Cancer Research UK is a really reliable website as well. They've got a good article on sugar and cancer on there, so if you're wanting a bit more information, that's quite good to look at. British Nutrition Foundation, again, is a really reliable website. They've recently released questions and frequently asked questions, so diet and cancer risk. So often they'll have those big questions on sugar, alkaline diet, vegan diet, things like that, and that's a really good website to look at. And there's just little paragraphs on each of them. You've got your Macmillan Cancer Support, again, reliable website. They have a nice section on healthy eating and cancer. And if you're struggling with a lack of appetite, if you're struggling with weight loss, they do have a good building up diet booklet that you can order from there, or you can download as a PDF to get any extra ideas or any extra tips from there. The British Dietetic Association, again, is a very, very, very good website, which is I'm also a member of. So when you type in, BDA or British Dietetic Association food fact sheets, that's where you can get lots of individual fact sheets for, so for example, calcium or iron or IBS or certain situations, vegan diet. If you just type it into Google, type it onto the website, then you can look it up, and then there's PDFs for you to download, and they generally are written by dietitians as well, so it's a reliable source of information. They also have recently released this year a very good Cancer Diets, Myths and More article that talks about the sugar, the alkaline diet, the vegan diet, dairy products, hormones, talks about all those acid-based diets, and it breaks it down into a bit more. And if you look onto it, if you type it into Google, you can download kind of the background reading behind it, which will list all the articles and the studies that it actually uses to kind of prove why they've come to that conclusion. Again, Maggie Centre is also a really good website to look at, and there's lots of different centres in the UK, so find one that's local to you. You might actually find there's some nutrition workshops on there that you can attend. NHS is also obviously a very good website to look at. So NHS Reference Intakes Explained, that talks about kind of the proportion of protein, fat and carbohydrates, what proportion you should have in your diet, and explains why. But also if you look at NHS vitamins and minerals, it brings up each of the vitamins and minerals, so vitamin A, B, C, D, E, on list of minerals, your iron, calcium, magnesium. It talks about actually how much is recommended per day, but also tells you what dietary sources you can get them from as well. So that's a really good way of, when you're looking at a multivitamin and seeing actually, does that meet my nutritional needs of iron, or does that meet my nutritional need of, calcium or whatever? You can actually compare that to the NHS vitamins and minerals recommendations. If you just type that into Google or so, you should be able to pull it up and find specifically which vitamin or mineral you're looking for. And that can be quite a good way of guiding how much, whether this multivitamin is good for you and what you're lacking in as well. Also, obviously, Target Ovarian have their own booklet as well. It's just like a mini guide for diet and nutrition. Again, will give you lots of different ideas on what you can do to improve your health and your nutrition, especially when you're struggling with a lack of appetite or if you're losing weight, but also has sort of some ideas on healthy eating as well. So, and there's, I think, a link in the chat as well. I think someone's going to pop it up. Okay. Thank you so much for listening. I know I've spoken for a long time, actually. I've gone a bit over, so apologies for that. But thank you so much for listening.
Wonderful. Thank you so much, Janet. I think that was really useful and you managed to cover loads. So thank you so much. So yeah, we'll move on to the Q&A part of the session. So before we kick off, one of the questions we received was actually asking for suggestions on how to jazz up vegetables. Someone isn't keen on the vegetables. So if anyone has any great recipes that they might feel like sharing, please do add those to the chat. If you'd like to just share your favourite recipe with us, you can also do that in the chat as well. So let's get started. So we had a pre-submitted question around IBS-like symptoms. So they said, since my diagnosis, I've developed IBS-like symptoms. Can you share any tips to cope with this? But we've also noticed that in the chats, we've had quite a similar question. So they've mentioned that due to the steroids, 4 days after chemo, they get very constipated, which they usually treat with medication. But by day 5, they suffer with awful cramps and loose stool. So do you have any suggestions on these?
Yeah, so with regards to IBS, there is obviously the first line advice, which if you look on sort of the British Dietetic Association, if you just type in food fact sheet for IBS, which I actually looked at before coming onto this, and they have actually really nicely written out all the first line dietary advice, which often if you go to see a dietitian, they might actually go and direct you to that to begin with so that you can imply that first. But it is just trying to make sure that, and I think obviously IBS is very different as well, because you've got different symptoms from IBS. It's whether you're constipated, whether you've got more diarrhea, whether you've got more cramping, or whether you've got a mixture of both. So there's different categories within IBS. So dietary requirements or dietary advice is dependent on actually what symptoms you're experiencing. But first line generally is to try and reduce your alcohol intake is first. Try to exercise, take time with your meals, make sure you're having a regular meal pattern, so don't skip meals. Make sure you're having adequate diet as well, so you're not just having snacks each time, but having proper food. Trying to limit your consumption of fruits to, I think it's just 2 portions per day, so focusing more on vegetables. If you are more constipated, again, if you're steroids and you're constipated, then actually we'll probably manage better with laxatives, which is what the doctors have probably prescribed. But actually with constipation, it's making sure you're drinking enough, because actually often people probably aren't aware of how much they drink, or they actually know that they probably don't drink enough. And actually having adequate fluid intake is important when you're constipated, and it can help your gut, because actually the water draws into the stool to soften it, to allow it to pass easier. So that's why it's really important to drink as well, to drink plenty of fluid. And often I would recommend sort of more plain fluids, so water or sort of fruit teas, rather than your squash, because the sugar probably isn't good in the first place. But if it's the sweetness, sometimes the sweetness can cause more IBS symptoms as well. So maybe just going for more plain. Again, if it's like fizzy drinks, again, that can make your IBS worse. If you've got more like bloating like symptoms or cramping like symptoms, that can also make it worse. So I probably just suggest drink plenty of water.
Okay. Thank you, Janet. You touched on, during your presentation, you touched on some sort of special diets, but we're wondering what your thoughts are on a vegan diet. And we've also had a question in the chat asking about whole food, plant-based diets as well. Can you let us know your thoughts on both, please?
Yeah. So I'm not against vegan diets at all. Actually, vegan diets, they do promote a lot of, because it's plant-based, they will have a lot of adequate fiber intake. It's very different from someone saying a vegan diet and completely cutting out all dairy products and cutting out all meat and not doing anything about it, versus someone who has a very much planned vegan diet where they have suitable alternatives. They go for the non-plate sort of the non-meat alternatives to make sure that they've got adequate protein. So that's something I would be sort of encouraging, is that if you say that you are a vegan, and make sure that you're having the suitable alternatives. So actually with vegan diets, often you lack a lot of calcium because actually you've completely removed all of your dairy products. So it's just making sure that you're having non-dairy alternatives. So if you're having your soy milk, your oat milk, rice milk, just make sure it's fortified with calcium. Make sure you're having your green leafy vegetables, make sure that actually your calcium intake is adequate. Again, if you're following a vegan diet, then actually you've got a lack of vitamin B12, because often vitamin B12 will be found in animal products. So actually by eliminating that completely, then actually you're going to be more likely at risk of vitamin B12 deficiency. So it's just making sure you're taking a supplement for that. I'd say as long as if you're following a vegan diet and you have suitable alternatives, you're having adequate protein intake from your soy, your tofu, your beans, pulses, lentils, then actually it's fine for you to have, but make sure you are taking vitamin B12 supplement or an injection or whatever it might be.
Fantastic, thank you. I just noticed in the chat someone's offered some advice around the constipation. They mentioned that they're now not taking medication and just relying on having sort of brown flakes for breakfast and during the evening, which is a nice tip. So just thought I'd pass that on.
That's good. Oats is also quite good because oats in the morning provides a lot of soluble fibre, and that can help sort of your gut as well. So that's also a good option to have, as well as brown flakes.
Fantastic. Thank you, Janet. So I know you touched on what to prioritise eating when you've had a loss of appetite. However, someone's asked and mentioned that they've unintentionally lost quite a lot of weight. So do you have any advice for how to increase your appetite?
I think it's important to find a balance between, you know, having foods that you fancy. So try to make the most, because when you don't have an appetite, you might have sudden cravings. And again, if you can have the food available, then actually that can help with that. But again, you know, making sure you're getting fresh air, going for a walk, sometimes that can stimulate more of an appetite. Sort of maybe going for more interesting flavors, interesting foods, you know, more colorful foods, try and entice the appetite as well.
Thank you. So the next question we've had, someone mentioned they were feeling quite tired. So their question was, I've not eaten any processed meat and very little red meat since my treatment almost 5 years ago. Unfortunately, my iron levels tend to be a bit low. I'm happy not eating meat, but don't like being tired. Can you suggest anything?
Yeah, so I guess with the iron, I'd say that there's probably no harm for you to have some meat. You know, I think even within the healthy, balanced diet, you'd still, you know, the recommendations are you can still have at least up to 3 portions of red meat a day. So if you're not having anything at all and actually you don't mind eating it, then there's no harm in having that, because actually that is going to be your main source of iron. But also, again, liver, you know, things like your green leafy vegetables, that would be a good alternative. But again, when you go for more, and beans, pulses, lentils, again, will have some iron in. But when you start focusing on non-meat iron, so, you know, your plant-based sources of iron, they are going to be harder to absorb. So, you know, when you are having that, maybe having a glass of vitamin C or having some orange juice or whatever, it helps absorb better, because the vitamin C helps absorb the iron better. So that would be something that I'd recommend. Again, sort of, I think tea and coffee, again, they contain compounds called tannins, which can also affect and disrupt the absorption of iron. So maybe avoid drinking tea or coffee whilst you're having your meals, just have it afterwards or beforehand. That can also help with the absorption process. But if you find that you're still lacking, then it might be that you just take an iron supplement as well. I'd recommend, if the doctors have recommended you not to have meat, if there's a particular reason behind it, but you do find that you're having low hemoglobin or low iron, and the doctors have noticed that, then actually it might be that the doctors need to prescribe you an iron supplement.
Great, thank you. We've had another question in the chat. They mentioned that the chemotherapy has affected their liver function. Do you know of anything they could perhaps take, or perhaps changes to their diet that might support the recovery of their liver?
Unfortunately, I don't think there's anything I can recommend for liver function, especially when it's related to treatment, unfortunately.
Someone mentioned, I'm undergoing chemotherapy. Do the general nutritional guidelines apply, or should I be making any changes to my diet?
So if you're under chemotherapy, I'd just watch out for any side effects. If you're relatively healthy and you've not had much side effects from chemotherapy, then actually the healthy eating guidelines would apply, as long as you're maintaining your weight, you're well nourished, there's no nutritional concerns. But if you're going through treatment, you're starting to lose weight, and actually there are concerns, you're starting to have a lack of appetite and everything else, then actually I'll probably say that healthy eating probably isn't the priority. By all means, you can still find a balance. It's not saying one or the other. Is finding out, I think the main thing when you're going through treatment is that we don't want to see individuals losing weight, because when people start losing weight, it affects their performance status, and that is taken into account when they're on treatment as well. And so if you're going through treatment, you start to get some side effects, but actually it's managed medically, you know, you're on tablets or there's certain things that are helping with it, and you're managing those symptoms, then by all means, there's no reason why you can't follow a healthy, balanced diet, given that you're still maintaining that weight. If you then start losing weight whilst doing that, it might be that you just need to focus on either fortifying your meals, so adding plenty of butter, cream, cheese, using the full fat options, having a few extra snacks there, here or there. But it's not to say you have to go excessive amounts. it's just to see what that does to your diet, see what that does to your weight. If you start maintaining that weight again, then continue as you are. If you find that actually even that in itself, you're still losing weight, then actually I'd say let's not prioritize your fruit and vegetables. Let's not prioritize healthy eating. Let's just snack, go for all the high calorie options, full fat options, almost focus on trying to just maintain that weight. Try to make sure you've got adequate calorie intake, because we don't want anyone with a low BMI, we don't want anyone to lose significant weight either. And at that point, if we're still struggling with that, it might be that we need to start thinking about supplements. But there's no harm in, as long as you've not got type 2 diabetes or anything, your blood sugars are out of control, there's no harm in having a fruit smoothie, a homemade fruit smoothie, plenty of milk and ice cream in there as well, just to try and boost up the calorie intake, in addition to a healthy, balanced diet.
Fantastic, thank you. We're coming to a close. I think we'll just do one more question if that's all right, Janet.
Yeah.
Fabulous. This question was, following my diagnosis and treatment, are there any changes I could make to my diet to help me look and feel better about myself?
Yeah, it's a very good question. I think, firstly, if you find that actually, I guess it depends on what state you're in at the moment in time, but I would say, making sure that you've got a balanced diet. So if you're lacking in certain nutrition, making sure you're taking a multivitamin to make sure that you're overall balanced, whether it's from supplements or from natural food and diet alone, to make sure that your body's well nourished. Try and get out and do a bit of activity, do things that you love, do hobbies that you love. When you find that you're maintaining your weight, you're well nourished, it gives you a bit more energy to be able to do the things that you do enjoy doing, and that can promote a bit more of a quality of life as well. But I always suggest, but whatever state you're in, just make sure you have SMART goals. We say SMART, so S is specific, so something basic, something small. M is measurable, so that you can actually see whether you've done it or not. A is whether it's attainable, whether it's achievable. Can you actually do it? Do you have the support to do it? R is whether it's realistic. Have you set yourself, the task to do? Can you actually do it? And then T is timing it. Give yourself a time frame so that you can see whether you've actually achieved it. And actually, by making yourself have these SMART goals, telling family members, telling your friends that they can support you so that you can achieve these things. It might be something really simple, but actually that is a really good way of making you feel better and giving you a bit more control of your situation that you're in as well.
Great, thank you so much, Janet. So we are now officially at the end of the webinar. So thank you so much, Janet, and to all of you for joining us. We got through so much, but apologies that we weren't able to answer all of the questions, but we hope that you've enjoyed the session and found it really helpful. If you'd like more opportunities to speak to others affected by ovarian cancer and to experience more of our digital events together, we would recommend joining the ovarian cancer community. This is an open and understanding Facebook community for everyone affected by ovarian cancer anywhere in the UK. And remember, if you do have any further questions or concerns, or would just like to have a chat, our support line is available for you to talk to one of our nurses. So please do give us a call on 020 7923 5475. So yeah, thank you again, Janet, who delivered such a great session, and to all of you for joining us and making it such a wonderful event. We hope to see you again soon and hope you enjoy the rest of your day. Thank you very much.
Thank you. Bye-bye, everyone.